This week on States of America.
Lawmakers were starting to, come out with tears as I was talking to them about what they experienced.
Speaking loudly and enthusiastically and yelling. This is exactly the kind of environment where the COVID virus can spread.
If you were to say to me, well, can you attach a date when it may be safe to go back in the water, so to speak, I would say that it seems like it's going to be towards the end of the summer, the early fall of 2021.
2021 is just weeks old, and yet we've already seen history being made.
Today, in a bipartisan way, the House demonstrated that no one is above the law.
We ask you to send your question to us on Twitter and Facebook on our Across the Aisle, Across the Nation page, and you did. We're going to deal with those questions with my colleague, Crystal Hayes, congressional correspondent for USA Today. Crystal, thanks so much for being here.
Thanks for having me.
Amazingly, you were up on Capitol Hill during the impeachment of Donald Trump this week. Also there when he was impeached the first time, almost precisely a year ago. Tell us what it was like.
So almost everything was different. I mean, the Capitol itself was different. We saw those photos of, thousands of National Guard troops sleeping in the halls, roaming the Capitol, guarding outside, to even how the vote was. Not a single Republican joined Democrats last time. And this time we had 10 House Republicans, including the number 3 Republican in the House joining Democrats this time. And even after they passed this, there was no celebration. It was a gloomy occasion. There was no clapping. Even as Pelosi signed off on this impeachment article, she didn't use an array of pens. She used 2. Everything about this just felt different. And, the Capitol itself was still healing. There's still plywood over many of the windows. There's still, a lot of damage that was inflicted to that building. So it just, just the change in what happened last year to this year, it's almost hard to put into words.
Of course, impeachment is the most solemn of affairs, but it sounds like this impeachment was even more solemn than the impeachment we saw just a year ago. And I wonder if the deployment of thousands of National Guard troops to the Hill, since it was just a week since the mob was marauding through the halls, was there a sense of physical peril on the part of the members of Congress who were participating in the impeachment?
I mean, it just felt so much more personal, I think, this go around. I was there on Wednesday talking with lawmakers after all this happened, and our conversations felt so personal. Lawmakers were starting to, come out with tears as I was talking to them about what they experienced. And I think the sense of duty here is just a little different. And I think that's why you saw so many Republicans join with Democrats. But I'm actually curious as to what you think here, because you've been in DC for decades, chronicling Washington, chronicling this history. And, I don't know if you can kind of speak to the broader moment we're in and kind of where you think this fits in history.
Well, this is actually the 3rd presidential impeachment I've covered. That's not something I ever expected when I came to Washington. I covered first, besides the Trump impeachments, I covered Bill Clinton's impeachment back in 1998 and 1999. That was also a fiercely polarized time, big divisions, fierce divisions and battles between Republicans and Democrats. But the difference this time is that there was not a sense that our democracy itself was in peril. And I think that is something that lawmakers on both sides felt this time, that the riot that we saw, which could have been much worse even than it turned out to be, kind of underscored the fragility of our institutions and reinforced the idea that we need to do what we can to reinforce them. The other thing we should notice how fast it all happened. Number one, it happened just a week after the incident, the violent incident on the Hill. And the impeachment proceeding itself only took about 3.5 hours. So this was, it was like speed dating, impeachment by speed dating. This time it all happened so fast. We've got some questions that also deal with questions of timing. Let me go to those. Jay Rosh wrote us at usastoday.com with this question. Does Trump have to be impeached before Inauguration Day. So, Crystal, could he be impeached, that is, tried in the Senate, after the inauguration of the new president is over?
Yes. And you know, it's kind of interesting delving into this question because there is differing schools of thought on it. Constitutional scholars right now currently are debating about this. And this hasn't been really tested with a president before. If you go back through history, it has been tested with, Secretary of War, definitely with different judges, and even a senator. And the Senate has acted in different ways. One case in like the 1700s, the Senate chose to dismiss the case because they thought that they didn't have jurisdiction. The Constitution kind of outlines that those who could be impeached are civil officers. And at the time, the Senate found that this former senator was no longer a civil officer. But there is showings throughout history that the Senate has acted in different ways as well. Right now, we know that Senate Majority Leader and also Minority Leader, and basically all of those in Congress are operating under the school of thought that the Senate will conduct a trial. But I think this challenge to whether the Senate can hold a trial is something that we might see from the president's attorneys.
Yes, we might see a challenge to that. And of course, the reason that the advocates of impeachment give for continuing with an impeachment trial, even if the president has left office, is to both make the judgment of history that what he did was an impeachable offense, and also because you could have a secondary measure taken by the Senate by majority vote to prevent President Trump from ever holding federal office again. We've gotten other questions about the timing of the Senate impeachment trial, which could theoretically say that President Trump not should be removed from office, should not be allowed to perhaps to hold office again. We're going to put those questions together. When do we think the Senate will take up the impeachment trial? They're not scheduled to be back in session until January 19th, just a day before the inauguration. Now, the Constitution requires that once the Speaker of the House sends the articles of impeachment over to the Senate, they need to take it up.
We are doing what we have to do under the rules. We will now hear presentations of evidence.
Mr. Chairman,
Gentleman is not recognized.
But of course, whether that only applies once the Senate is in session. There was a time when bringing the Senate back into session, which is what some Democrats would like to see happen, required unanimous consent of the Senate. That's no longer true. A few years ago, that was changed so that the majority and minority leader could agree to have the Senate come back in session. But Mitch McConnell does not seem interested in doing that, Crystal.
No, he doesn't. Yesterday, he basically said unequivocally that will not happen. He argued that a Senate trial will take multiple weeks, and that would converge ultimately with Joe Biden's inauguration next week. He argued that, for the Senate to conduct this trial and conduct it fairly, they would need several weeks. And right now, kind of throwing all their assets and all the attention to next week's events with the inauguration would be a little bit more of a fruitful thing instead of kind of having this sort of split screen with the impeachment and also Biden's inauguration.
Yeah. There's another possibility which Joe Biden is really hoping for, and that is, the Senate will have to take up the trial. They could spend part of their day at trial, part of their day doing his business, confirmation of cabinet nominations and other senior people for his administration, and also considering the legislation he wants to pursue as quickly as possible, both to deal with the coronavirus pandemic and also to work on this faltering economy we have in this country now.
Yeah, and you're absolutely right. And, the Constitution and how kind of the Senate rules dictate how a trial would work would allow this. In the morning, senators could conduct business, could have hearings, could have committee events, and then in the afternoon, they would be in a court of impeachment. We saw this discussed even last year during Trump's impeachment as there was still pending business before the Senate. So we could see something like this. And since Democrats will control the chamber, this could actually be something they do.
Yeah, but in one way or another, it looks like Joe Biden's first days as president will be marked by the impeachment trial of his predecessor. That's something that no president has faced ever in American history. We know Joe Biden is asking Mitch McConnell and Chuck Schumer to allow the Senate to do a kind of bifurcated system where they'll spend part of their day on the trial, part of their day in confirming his nominations for the cabinet and other senior officers and dealing with legislation he plans to submit to deal with the coronavirus and the economic recovery. Here's a final question. Will Trump face any sort of charges? Now, of course, the impeachment by the House that's already happened isn't charge of a sort. It's kind of like an indictment. But I think he may be referring to criminal or civil charges through the court systems. What do we know about that?
So this has been a question looming over Trump's presidency for most of his 4 years. Right now, currently, there is examinations in the state of New York looking at the president's personal businesses and whether he may have conducted any sort of financial crimes. And that probe is ongoing. And after the president leaves office, he also doesn't have this sort of shield that the Justice Department has considered that basically bars any sort of sitting president from being charged with a crime. So, over the months, a lot of folks have been looking at kind of what's happening in New York as the possibility of the president facing crimes or even his family. Of course, we know over the last couple of weeks, as the president is getting ready to leave office, he's been issuing a number of pardons and even is reportedly examining pardoning himself and his family. And then that's not even to mention what happened last week and over the last couple of weeks with the president and his kind of challenge to the election results and his conversations with Georgia's Secretary of State and that, now almost infamous phone call, and also whether or not he could be charged with what happened at the Capitol. There's been lots of questions about this, and there are federal crimes that, those are, possibilities here.
Crystal, there's been a kind of modern tradition that presidents, when their term is up and they move out of the White House, they kind of fade from public view. They stop making news. I have a feeling this is another norm that Donald Trump is going to smash. We're going to be hearing from him for some time to come. Well, Crystal Hayes, thank you so much for joining us.
Thank you.
There's no telling how much spread there was among the insurgents. And as they've gone back home to their community,
the Trump rally that ended with protesters storming the Capitol building last Wednesday is having many ripple effects, with thousands of maskless protesters coming from all over the country, most of whom went right back home in the days following. What will be the impact of this mass gathering on COVID numbers? I'm Adriana Rodriguez. I'm a health reporter for USA Today. Joining me now is Dr. William Schaffner, professor of infectious diseases at the Vanderbilt University School of Medicine and medical director of the National Foundation for Infectious Diseases. Welcome.
Good to be with you, Adriana.
So we want to go back to the event, as we remember, in the White House with the Rose Garden event surrounding the confirmation of Supreme Court Justice Amy Coney Barrett. We had multiple infections that had stemmed from that event. Now, what kind of transmission are we looking at with this sort of event, the Trump rally, and then also the attack on the Capitol?
Well, Adriana, this was a perfect storm for the transmission of the COVID virus. Starting out, these are people who are skeptical of COVID. We didn't see people wearing masks. So it's likely back in their communities, some at least had already acquired infection with COVID. And so this mass gathering, the COVID virus was part of it. And so people gathered closely together, whether they're indoors or outdoors, were and speaking loudly and enthusiastically and yelling. This is exactly the kind of environment where the COVID virus can spread.
They don't get to tell us we didn't see what we saw.
And we already have some demonstration of that having happened to congressional representatives. We have several of those people who, subsequent to this rally, have tested positive. There's no telling how much spread there was among the insurgents. And as they've gone back home to their community, I'm sure several of them have become ill and beyond that have spread the virus to their friends and family members.
And I'm glad that you touched on that with certain congresspeople testing positive, because most of them blame other colleagues for not wearing masks. What are your takeaways on that?
We can't really tell exactly where that COVID virus came from. Obviously, if people haven't been wearing masks, they are a potential source of the virus. We can't say conclusively. There was an awful lot of interaction and lots of people giving energy to their voices. And thus, had they been infected, they would be spreading that virus rather widely.
We have another event coming up next week for the inauguration of President-elect Joe Biden, and where we expect thousands of more people to congregate in DC. What do you expect in terms of a transmission there?
My advice is stay home, everybody, because once again, if people come close together, many of them perhaps not wearing masks, there's always the potential for transmission. Not to mention all the travel to and fro, which once again are circumstances where this virus can spread. We're having a surge of new cases across the country, resulting in a subsequent surge of hospitalizations and deaths. There are 4,000 people dying a day in the United States. We've got to start bending this curve down. Stay home, everybody. Clap and watch it on television. Wear your mask, social distancing. Avoid large groups. Whatever the cause of the group, whatever the sponsor of the group, avoid it.
And speaking of surges, do you think that our nation is equipped to be able to handle spikes that result from these gatherings and large events?
Yeah, the question of our preparedness, our surge capacity in medical care is a very serious one. I'm glad you brought it up, because there are many parts of the country that are being stressed mightily. My own part of the country we're right at the edge, but there are other parts that already are very, very stressed. I know that there are many days when people would like to admit patients from community hospitals to our medical center. That's our role. We would love to take it. But if we're full, we can't do that. We have to help family doctors in community hospitals take care of very sick patients, much sicker than they're used to caring for.
With the Rose Garden event, we were able to track transmission based on different politicians because of photos they had together or events they had, and having them also announce on Twitter that they had tested positive. But how would we go about tracking maskless rioters?
Adriana, it's a very difficult thing to do. Traditionally, public health does try to trace back causes of infectious diseases to specific events. But when you have an avalanche of infections, such as we have with COVID, it's very, very difficult. In the Rose Garden event, and back in that motorcycle rally in Sturgis, there were very distinctive people, and they were easily identified subsequently, so we could trace infections back. It will be more difficult to attribute infections around the country to this event because so many of those people are, frankly, anonymous.
So many of these maskless rioters have been apprehended at their home states, which makes me wonder more broadly in terms of people in jails and in prisons who are engaging in high-risk behavior. What does that say about transmission and COVID in those systems, and the importance of vaccinations?
Well, jails are a congregate living facility, right? People are confined, they're very close to each other, and infection control is very difficult in those circumstances. Certainly in prisons, where people who are convicted go and stay for a long time, they've also been locations where there's been a great deal of transmission, not only to the prisoners, but to everyone caring for the prisoners. And so that's why, from a public health point of view, we put prisons certainly high on the list of locations where vaccine ought to be administered, because we want to reduce transmission and in these congregate facilities and the consequent deaths. Vaccinating prisoners, whether they're in jails or in prisons, is socially very, very conflicted. There are many people who think that we ought not to be extending preventive health services to these people who have been bad and convicted of some crime, while there are other people out in the community who are in high-risk circumstances who also need the vaccine. I don't think it's one or the other. I think we need to do both. From a public health point of view, we go to nursing homes, we go to prisons, we go to assisted living facilities. All these are circumstances where people are very close together, can transmit the virus readily, and hospitalizations and deaths result. In public health, we're interested in reducing the transmission of the virus and absolutely sparing hospitalizations and deaths.
Well, thank you so much for answering our questions today, Dr. Schaffner. I really appreciate it.
Good to be with you. Stay safe, everyone.
Even though it's frightening, it's disruptive, it's annoying, it is something that you will be able to manage and get through.
As we see COVID-19 cases climb across the country, the pandemic has also amplified the mental health crisis that's happening in the U.S. And teens are not immune. 70% say they are struggling with issues like anxiety, stress, and depression. Joining us now, Dr. Jeffrey Lieberman, Chief Psychiatrist, Columbia University Medical Center of the New York Presbyterian Hospital. We'll talk about the effect of the pandemic on teens, their parents, and what each can do to kind of manage the stress.
Teens are particularly affected because their life has been disrupted in a way that is very reactive to them. In other words, they can't go to school, they can't socialize, they can't do the usual things. And because they're more vocal about inconveniences and disruptions to what they want to do, they react to it, and their parents react to it, and their families react to it. It causes reverberations. The reality is that teens are resilient. They will be able to manage this with simple guidance and steps that encourage them to use mental hygiene.
Dr. Lieberman, let's expand on one of those terms I found very interesting, mental hygiene. How does a teen practice good mental hygiene?
Well, everybody knows about personal hygiene, being cleanly, brushing your teeth, flossing. The same thing holds for your psychological state. When you get up in the morning, think about what you're going to do. You should also think about, can I get a good night's sleep, or did I get a night's sleep? And if I didn't, what is causing me to not feel rested? And take note of your emotions. And you should do this a couple of times a day. Then what you should do is pause and take a few deep breaths, try and concentrate on something, and realize that this is something that, even though it's frightening, it's disruptive, it's annoying, it is something that you will be able to manage and get through.
What else can parents do to help their teens? I mean, are things like taking extra road trips or social media limits, like are these things, are they practical ideas or no?
So they shouldn't try and program the kids into doing all these things, which will be alternative substitutes. Let the kids, find a way to cope with this, but then also monitoring what they're doing, ensure that it's not going onto websites that are providing some inflammatory information, ensure that children aren't, or teenagers in this case, aren't taking matters into their own hands and trying to self-medicate.
What are your thoughts on these apps like Calm that kind of try to help others on their phone deal with these issues?
I can't speak to the quality control of these, but in general, there's probably no harm in reaching out and trying them as kind of initial efforts to seek some kind of attention or support. However, that may not be sufficient.
Dr. Lieberman, certainly when it comes to these vaccines, many have talked about the physical benefits of it as far as not being infected with COVID. We now know that Moderna is carrying on trials in teenagers, kind of like their next step as they go through, and they're looking for teenagers in 20 cities across this country to continue these trials. How might the development of this vaccine, and I guess the information that we'll gain about the vaccine in teenagers, help all of this stress that we're talking about in regards to both teens and their parents?
We have at least 2, which are currently being administered, with more to come, and they are going to be administered to the entire population. So that means that we know that the end is in sight. We see the light at the end of the tunnel. We're almost through this. And if you were to say to me, well, can you attach a date when it may be safe to go back in the water, so to speak. I would say that it seems like it's going to be towards the end of the summer, the early fall of 2021. Up until now, science was capable but limited in terms of what it can do. This shows you a new benchmark of the capability, and for somebody who's in the early stages of their life and have their whole life ahead of them, they can feel very good about the capacity for the scientific and medical community being able to make their life as good as it could possibly be.
Do you think that this will have maybe a long-lasting positive effect as far as people being more open about the issues that they're dealing with?
There is a historical kind of reticence and to talking about your own mental health in a way that's public or divulging to other people, and a certain stigma associated with it. I think this is going to bring it more to the fore.
Dr. Jeffrey Lieberman, Chief Psychiatrist, Columbia University Medical Center of the New York Presbyterian Hospital. Dr. Lieberman, thank you so much for the time.
Well, thank you, and thank you for focusing your attention on this important aspect of the COVID-19 pandemic.
Thanks for watching States of America, important conversations on the issues that matter.